Every year, thousands of husbands, wives, sons, daughters, and other loved ones from southeastern Wisconsin are treated at Froedtert Health Community Memorial Hospital Emergency Department. This community safety net operates 24 hours a day, 7 days a week, providing critical treatment as a certified Level 3 trauma center. As with most ER patients, Tim Smith's visit to Community Memorial's ER was unexpected after he was seriously injured in a work-related accident.
I work on the tools that go into the press. They call them tools or plastic injection molds. The press went down, it wouldn't close, so we had to separate the two halves of the tool. And because it was a new tool, I had to be present to make sure that, nothing was damaged, which turned out to be me, but anyways, we were separating the tool and it broke loose, and my natural instinct was to grab it. And it swung back, and there was an electrical box for hydraulics or whatever that we hook up to the tool was there, and my pinky got crushed in between the tool and that electrical box.
With a badly crushed finger, Tim was taken to Community Memorial Emergency Department, where he was treated by Dr. Jane Reed, emergency medicine physician.
It wasn't a life-threatening injury, but it was his right hand, and unfortunately it was crushed pretty severely, presented to the emergency department for evaluation.
Dr. Alex Kolke, a plastic and reconstructive surgeon on staff at Community Memorial, was called in to operate on Tim's finger.
When I first saw Tim's hand, he had a finger that was very dusky, purple, bluish. It was clearly not getting the blood flow that it needed to survive. It had a significant laceration and crush injury to the finger. It was clear that it needed emergent intervention in order to have a surviving outcome of that injury.
We continued to treat his pain. We gave him both IV pain medication as well as directly anesthetized the finger, and kept it moist, clean, and immobilized to preserve whatever vascular integrity he had left.
Dr. Reed did an outstanding job when she first encountered Tim. I was very pleased with the way she handled the case prior to me arriving to the emergency department.
This is definitely a team of excellent nurses that we work with here, so that does make a huge difference.
For Tim's injury, we had three options. The first one is to restore blood flow by establishing a connection of the blood vessels to restore blood flow to the tip of the finger. The second option would be using a vein graft to bypass the injured area to restore blood flow to the remainder of the finger. And if those were unsuccessful, then the third option would have been to ultimately amputate his finger.
That really numbed me. When someone actually tells you, like, if this doesn't work, that doesn't work, we'll have to amputate. I'm not sure where. It could be here, it could be all the way. It's like I just kind of went off into my own little world then.
To save Tim's finger, Dr. Kolke had to restore its blood supply right away.
And we took him emergently to the operating room, and it involved setting his bone, repairing his traumatized nerves that would allow the finger to maintain its sensation, as well as repairing the blood flow by doing microvascular anastomosis to his digital arteries. After I'd completed the anastomosis of his blood vessels, the finger pinked up and showed good signs of revascularization at that time. But even then, you're still not out of the woods. The patient needed post-operative monitoring in the intensive care unit for their expertise training to evaluate the finger for vascular compromise, and to do that at a specific time point to be able to intervene right away if there was a problem.
Thanks to the expert care of Doctors Kolke and Reed, emergency department staff, ICU nurses, hand therapists, and many other medical experts at Community Memorial Hospital and the Froedtert Health System, Tim's finger has healed and is nearly good as new. Being able to help people like Tim is the reason Tom and Pat Berg support Community Memorial Hospital financially.
To be involved in a community, you have to give back. We were very fortunate to own a successful business. The importance of supporting the hospital comes from the fact that both of us have been here. I've been in the emergency room. She's gone through the cancer care center.
Our two grandchildren were also born here, So this just seemed right.
Tim, who relies on his hands as a tool and die maker, has returned to work in the same position with the same responsibilities and is grateful for the excellent care he received at Community Memorial.
All the nurses, everybody involved, I mean, the care was just excellent. Everybody was constantly there, keeping an eye on me, making sure my pain level was bearable. I can't say enough.
Emergency care is something that you need now. The fact that it's right in our community, I think, is an extremely fortunate thing.
I think having a very responsive emergency department is very important to serve the community. You know, they're the first line of defense for emergencies like this. And in addition to that, I think having the expertise at the operating room here at the hospital and having them able to mobilize an operating room very quickly is important to the success of these types of cases.
We have board-certified emergency physicians here that can quickly identify the severity of a problem, and then we can tap into all of our specialists here, and then we have a vast array of specialists at Froedtert that also are available, which is an amazing resource to have.
I can imagine many communities wish they had a hospital of this quality close by. We are very fortunate not only to have it here locally, but to have it be such a first-class place to be.
Everybody that was involved in this, I think, did an excellent job. I mean, I have no complaints. I was blessed, and you're doing a fine job here.